The stimulus bill also provides more money to expand health care coverage through the Affordable Care Act.
This expansion is considered to have some of the most significant changes to insurance affordability in more than a decade. News 3's Madeline Parker joins us live in studio to break down some of the changes you might see. Good evening, Madeline.
Good evening, Julie. Mark, healthcare coverage under the stimulus bill is now more expansive and less expensive for more people. I spoke with a healthcare management instructor at SIU who explains that the timing of this coverage is what is most important.
And in a pandemic, maybe the importance of health insurance really becomes more prominent.
With the signing of the new stimulus bill by President Biden, many new changes were created to make the Affordable Care Act more accessible and more affordable.
I think one of the biggest provisions within the new stimulus bill is the removal of the income limit for subsidies on the marketplace.
This provision makes it so there is no cap on how much a person can make in order to get the federal subsidies from the individual marketplace. Subsidies act as a tax credit that can help lower monthly premiums. The stimulus bill says there are now $34 billion that can be used for subsidies.
Has been allocated for those subsidies, but that doesn't necessarily mean that people are going to actually use $34 billion worth of subsidies.
Still, Jessica Cataldo believes more will be able to take part in the Affordable Care Act since the bill removes the federal poverty limit.
That it was, truly an economic stimulus bill, if you will, and that recognizing healthcare can be very expensive for people. So how do we make it affordable so all of their income isn't going toward their healthcare?
Now, it's a waiting game to see if the allocated funds are used. Some estimates show it could cover as much as 1.3 million more Americans.
So I think that's really what remains to be seen with this bill is how many people will take advantage of those new subsidies that now exist.
Cataldo told me that those who will most greatly benefit from this bill are people who purchased insurance at low premiums but with high deductibles. These subsidies will help lower some of the costs that accompany insurance through the Affordable Care Act. Live in studio, Madeline Parker, News 3.